Oh, hello.
Oh, hello.
Thanks for joining us here on our second installment of Colorado medication assisted treatment video vlog series.
Yeah.
Our tree got great reviews last time, so we wanted to make sure that it was included in this video with us.
Very excited about it. It's still alive.
It's still alive.
So, Michael, what are we talking about today?
I have no idea. I was hoping that you would have prepared something.
I have.
Oh, great.
Funny you would ask.
Excellent.
So, today we're going to chat a little bit about medication assisted recovery, or the concept of recovery oriented MAT. Yeah.
Excellent.
That's kind of the that was what I had prepared. No, so today what we really want to discuss is the deep importance and value of a recovery oriented approach to treating opioid dependence, obviously with or without the MAT medications, but specifically when using MAT medications, the extreme necessity of integrating services that provide legitimate clinical care so people can achieve progress and not simply switch from one old behavior and system to another somewhat similar behavior and system of going to a person, having them give them a medication, going and taking it, and then coming back and doing it all over again. That the value in the work that we're doing and the value that any recovery oriented approach to MAT is doing is it's enabling a person to go from not just uh, not just active use to arresting the development of the active use, but actually achieving marked goals based off of clinical assessments, followed by clinical interventions, group, individual, all of that stuff.
Absolutely. Yeah, I think Cortland, like when you and I started talking about this program months ago, we did a good bit of research before we ever opened our doors, and like time and time again, as I met physicians and people in this field and people on MAT recovery, I was just shocked over and over and again about how little clinical care most people on Suboxone in this state were receiving. I mean,
Right.
we were talking at best case scenario hours a month, in a worst case scenario hours a year of therapy. And these are people who are, clients and patient systems, family systems that are in need of desperate like help. We're not talking about a like a small afternoon, like a minor drinking problem. We're talking about IV heroin users who
Right.
are
Fentanyl
receiving,
addicts.
yeah, who are receiving little to no care. And I just I think like this company for you and I are like in a lot of ways is a passion project of like knowing so much from our traditional recovery um, uh, upbringing, like both personally and professionally in this world, and seeing like what good clinical care can do for people, and then seeing this huge population that are in such desperate need
Right.
that we're receiving so little of it.
Right. And I think it's important to make the disclaimer that the public health value of having immediately accessible MAT medications is not something that we dispute. That it is absolutely necessary that there are clinics that make it possible to go in one day and by the end of that day be off of heroin and on to Vivitrol, Suboxone, any of the even Methadone, right? Like the value of getting off of IV drugs and off of something that will immediately lead to overdose and all sorts of communicable diseases, that is necessary. But on an individual level, we're seeing folks not stop using drugs and yet not clearly improve their lives in the ways that they hoped and at times were promised, right? They were told this medication is going to do one thing when really it really does quite another, right? What the drug Suboxone, the medication Suboxone rather, its abilities and what it's been what research tells us it can do is it can stop the use of opiates for periods of time, and it can help decrease cravings. There's nothing else that, I mean, and it is effective for people with pain issues. But if you look across all of the research, there's nothing that says that it has a psychosocial impact on your ability to communicate with your family, or that it will resolve the disaster of a relationship with your wife or your kids, or get you back into school.
Or trauma or depression or anxiety or family system issues or anything that we know comes with addiction or causes addiction or is caused by addiction.
Right.
Yeah. But it saves lives.
Right.
Yeah, absolutely, it saves lives.
So how does our program differ from an MAT clinic? What would be the process for a patient walking in the door? What would be the experience that they had versus attending a clinic? Aside from volume size, which will never be 1/20th of the size of a MAT clinic, but as far as individually what they will experience, what does that look like?
Yeah, that's a good question. I think it's they will experience just about everything here that they would experience at an MAT clinic, a Suboxone clinic, plus more. So you would get a full medical workup by a physician or a nurse practitioner, including things like blood work, urinalysis, a physical exam, infectious disease screens, those sorts of things that this population desperately needs. And in addition to that, they'll also get a full clinical assessment, clinical testing if and when needed. And then once the treatment begins, individual therapy, group therapy, family counseling, full kind of wraparound counseling services to support somebody's recovery in addition to the medication piece.
Awesome. Yeah, I think it was difficult for us to see when we started doing our research for this project that became CMAR. It was difficult to see programs. You see the phrase MAT constantly, and it stands for medication assisted treatment. And yet the statistical likelihood of somebody receiving the medication as an assist to treatment is infinitesimal. We're talking less than 10% of people that go to a clinic or go to their doctor to get MAT are actually having that medication assist the treatment versus just right? Like the medication being the treatment.
Right.
So yeah, I think that really is the value of a recovery-oriented approach, is that it takes medication out of the central position that it's in for the recovery process and makes it to us, and I think to our patients, really it's an ancillary to the treatment itself, right? Like the psychosocial interventions, the peers working with each other and holding each other accountable makes the prescription of the medication something that's certainly central early on, because somebody is sorry, your smile just really got me there.
It has an effect on people.
It's certainly a central theme to somebody's early process, but it quickly becomes secondary to in terms of the value that it's providing, because yes, of course it is. You're taking it in the morning, or if you're on Suboxone, you're taking it at the beginning of the month, and so it does play a role and it does have an effect, but it isn't what's the patient can really identify the work they're doing as generating progress in their own lives, and the interactions and relationships they're developing with our clinical staff, with our medical staff, as being greater than this medication. And that, to me, that's where the sustainable practices come into play, where it is sustainable and applicable. Sustainable in that you can do those things with or without medications, right? We can get you off Suboxone and we can get you onto Vivitrol, and ultimately, wherever that leads you, and still sustain all of the progress you're making. Which, if you only have the medication, that's not an option. You don't have an alternative solution if those medications aren't there. And if anything happens in your life, a doctor is essentially put in a position where they have to just increase dose versus...
Yeah.
Are you meaning to smile?
It's
a great... I don't know. I can't... Okay, sorry. And then the applicable piece is that you... Yes, Suboxone, Sublocade, just straight buprenorphine, all these medications are hugely effective and important, but you can't apply your medication to, the benefits of your medication to your marriage, right? Like you can't be like, oh, well, what I learned from Suboxone today was we should work together to resolve this issue. Whereas if you've learned skills, practiced skills, developed, psychodynamic skill sets because you are no longer suffering from the trauma of your childhood, then you actually can apply a lot of things to every other aspect of life, including your co-occurring disorders.
Yeah.
Or one's co-occurring disorder.
And I think that's the core of our program is we're at the core a recovery program, a treatment program, a therapy-based program, and not a medication-based program. I know we spent a lot of time today in our last video talking about medications because it is a different piece that we provide and something that we do really well at. But we are very much like at our core a recovery program for people suffering from opiate use issues.
Right.
So if a patient has, medications that they're receiving from a different physician, if they're not appropriate for Suboxone, most of the opiate acts would then be appropriate for naltrexone or Vivitrol. But that is not the core of our program necessarily. Is the medication management. The core of our program is the structured clinical counseling, the interventions, the family therapy, the group therapy that provides, specific treatment for this population. Things like pain management, things like trauma resolution skills, things like interpersonal communication, things like family support. And that is more so what this population needs. And the medication is here to assist that. The medication is here to reduce cravings. It's here to reduce the impact of their chances of acquiring infectious diseases, and in like the most severe cases, the medication is here to keep them alive long enough to respond to the therapy to benefit from the treatment.
Yeah. Wow. Well, thank you very much. I think this was a really productive conversation.
It was. So thank you for joining us as well on we should call this talk show On Either Side of a Fern.
I mean, but it's not a fern. It's on either side of a succulent?
I have no idea. Little tree thing?
A banyan? Is this what a banyan is? No one really knows.
But we're going to keep doing these video series a couple times a month or so. So keep an eye out and let us know what you think.